Good morning, good afternoon, and good evening. Hey guys, welcome back to the channel. My name is Omer and I'm a doctor. My aim is to bring you knowledge which can improve and sometimes even save lives. In today's video, I'll tell you everything you need to know about eczema. What is eczema? Eczema is a form of dermatitis. This essentially means inflammation of the skin. The most common type of eczema is atopic eczema. Atopic means your skin is more sensitive or allergy prone. People with atopic eczema are more likely to have or develop hay fever or asthma at some stage. Most cases are seen in children under the age of 5 years, and up to 1 in 5 school children have some degree of atopic eczema. Most people usually grow out of eczema by their mid-teens. Uncommonly, adults can also develop eczema. How to recognize eczema? Eczema usually affects the front of elbows, back of knees, wrists, face, scalp, or around the neck. Face is more commonly affected in babies with atopic eczema. However, any areas of skin may be affected with dry skin, red and inflamed skin, itchy skin. Sometimes the areas affected can become blistered, weepy, and crusty. This is usually a sign of infection. I will talk more about this later on. In mild cases of eczema, a flare-up causes a few patches of inflammation around the body which only occur now and then and are treated easily. In more severe cases of eczema, larger areas of the body are affected and can take several weeks to heal. What are the causes of eczema? The causes of eczema are not fully understood. Research has shown that the oily layer of skin which acts as a skin barrier is reduced in people with atopic eczema, and this allows increased water loss from the skin. This in turn causes the skin to become dry and itchy. Also, some cells of the immune system may release chemicals under the skin's surface, which can cause some inflammation. Genetics play a part, so if either one or both of the parents have had an atopic condition such as eczema, hay fever, or asthma, then the child is more likely to develop either one or a combination of these three conditions. Some things that may aggravate eczema or cause flare-ups are changes in climate, pollution, allergies to house dust mites or pollens, diet, infections. How do I treat eczema? The usual treatment consists of 3 parts. Avoiding irritants to the skin and other causes or triggers wherever possible. Use plenty of moisturizers daily to help prevent inflammation developing. Topical steroids can be used for the short term when inflammation flares up. Let's talk about these in more detail. Many people with atopic eczema have flare-ups from time to time for no apparent reason. However, some eczema flare-ups may be caused or made worse by irritants to the skin or by other factors. It is commonly advised to avoid soaps, bubble baths, etc. when you wash because they can dry out the skin and make it more irritated. Instead, use a soap substitute and a bath moisturizer. Use sensitive washing powders and fabric conditioners. Try as much as possible not to scratch, as this will only aggravate the problem. Wear cotton clothes rather than irritating fabrics such as wool. Avoid getting too hot or too cold, as extremes of temperature can irritate the skin. House dust mites may be a trigger in some cases, so regularly clean and vacuum, paying particular attention to your bedroom, mattress, and bedclothes. Food allergy may be a trigger in some cases. About 1 in 2 children with atopic eczema have a food allergy which can make symptoms worse. The most common food allergies which trigger symptoms in some people include cow's milk, eggs, soya, wheat, fish, and nuts. If you suspect food is making your child's symptoms worse, then see a doctor. You may be asked to keep a diary over 4 to 6 weeks, which may help to identify 1 or more suspect foods. Other atopic eczema triggers. Other possible factors which may trigger symptoms or make symptoms worse include stress and habitual scratching, pollens, molds, and dander from pets, pregnancy and hormonal changes before a period in women. Let's talk about moisturizers, also known as emollients. I can't stress this enough, moisturize. 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 Dry, itchy skin tends to flare up and become inflamed into patches of eczema. Emollients are lotions, creams, ointments and bath or shower additives which prevent the skin from becoming dry. The regular use of emollients is the most important part of the day-to-day treatment for atopic eczema. They oil the skin, keep it supple and moist, and help to protect the skin from irritants. This helps to prevent itch and helps to prevent or to reduce the number of eczema flare-ups. Some points about emollients include: as a rule, thicker, greasy ointments work better and for longer than thinner creams, but they are messy to use. Apply liberally to all areas of the skin. You cannot overdose or overuse emollients. Apply emollients in the general direction of hair growth. Use emollients every day. A common mistake is to stop using emollients when the skin appears good. Patches of inflammation, which may have been prevented, may then quickly flare up again. Various emollient preparations come as bath additives and shower gels which can be used in addition to your normal day-to-day moisturizing routine. Pump dispensers are better than pots because they are less likely to harbor germs. If you need to use a pot, use a clean spoon or spatula to get the contents out, rather than your fingers. One of the mainstay treatments for eczema is steroids. Topical steroids work by reducing inflammation in the skin. The greater the strength, the more effect it has on reducing inflammation, but the greater the risk of side effects with continued use. It is best to apply steroids 10 to 15 minutes after moisturizing the area so that they are absorbed more easily by the skin. Creams are usually best to treat moist or weeping areas of skin. Ointments are usually best to treat areas of skin which are dry or thickened. Lotions may be useful to treat hairy areas such as the scalp. In many cases, a course of treatment for 7 to 14 days is enough to clear a flare-up of eczema. In some cases, a longer course is needed. What about side effects of topical steroids? Sometimes side effects can occur because of repeated steroid use or prolonged use. Some of these side effects are: skin thinning is uncommon, but it can occur. It is reversed once steroids are stopped. Skin may develop stretch marks, bruising, discoloration, or thin spidery blood vessels. Topical steroids may trigger or worsen other skin disorders such as acne, rosacea, and perioral dermatitis. Infected eczema, eczema herpeticum. Let's briefly talk about what to expect if a patch of eczema is infected. Sometimes, one or more patches of eczema become infected during a flare-up. Things to look out for would be: weeping blisters, crusts, skin unusually red, hot and tender, developing temperatures for no other apparent reason. If your doctor feels your eczema is infected, you may require topical antibiotics and in some cases oral antibiotics. So what if the normal eczema treatment doesn't work? If your eczema is particularly hard to treat or you are having very frequent flares which are hard to manage with the recommended treatment, then you may be referred to a dermatologist to consider other treatment options. Very briefly, these treatment options may include considering immunomodulator drugs, oral steroid tablets, medicated wet wraps and bandages, tar shampoos, antihistamine tablets, and even medically supervised dilute bleach baths. We have covered a lot of very useful knowledge in this video, and I hope you, or someone you know, will be able to benefit from it. I am a full-time doctor, and I have made this channel to provide you with beneficial medical knowledge. Please consider subscribing if you have found this beneficial and for more useful content. If you have any suggestions for future videos, then please leave a comment below. All the best, guys. Look after yourselves and stay healthy.